free next-gen NCLEX-RN practice questions with answers. Question 1. The nurse begins morning assessment on a male client and notices that she is unable to palpate either of his dorsalis pedis pulses in his feet. What is the first nursing action after assessing this finding? Here are the options. Option A. Palpate these pulses again in 15 minutes. Option B. Use a Doppler to determine presence and strength of these pulses. Option C. Document the finding that the pulses are not palpable. Option D. Call the physician and notify the physician of this finding. The correct answer is option B. Use a Doppler to determine presence and strength of these pulses. Palpating these pulses again in 15 minutes may only result in the same findings. Be any time during an assessment that the nurse is unable to palpate pulses, the nurse should then obtain a Doppler and assess for presence or absence of the pulse and pulse strength, if a pulse is present. C. Pulses may be present and assessed through use of a Doppler. Absence of palpable pulses does not indicate absence of blood flow unless pulses cannot be located with a Doppler. D. The nurse would only call the physician after determining that the pulses are absent by both palpation and Doppler. Question 2. The physician has prescribed metoclopramide Reglan. When assessing the client, the nurse would expect to find which of the following responses. Here are the options. Option A. Increase in gastric secretions. Option B. Increase in peristalsis. Option C. Disorientation. Option D. Drowsiness. The correct answer is option B. Increase in peristalsis. A metoclopramide does not stimulate gastric secretions. B. This response is expected with metoclopramide, in addition to increasing gastric emptying. C. Disorientation is a symptom of metoclopramide overdose. The drug should be discontinued. D. Drowsiness is a symptom of metoclopramide overdose and the drug should be discontinued. Question 3. A 33-year-old client was brought into the emergency room unconscious, and it is determined that surgery is needed. Informed consent must be obtained from his next of kin. The sequence in which the next of kin would be asked for the consent would be. Here are the options. Option A. Parent, spouse, adult child, sibling. Option B. Spouse, adult child, parent, sibling. Option C. Spouse, parent, sibling, adult child. Option D. Parent, spouse, sibling, adult child. The correct answer is option B. Spouse, adult child, parent, sibling. A spouse and adult child would be asked before a parent. B. The order of kin relationship for an adult, as determined from legal intestate succession, is usually spouse, adult child, parent, sibling. C. Parent and sibling would be asked after adult child. D. Spouse and adult child would be asked before parent. Sibling would be asked last. Question 4. A client had abdominal surgery this morning. The nurse notices that there is a small amount of bloody drainage on his surgical dressing. The nurse would document this as what type of drainage? Here are the options. Option A. Serosanguinous. Option B. Purulent. Option C. Sanguinous. Option D. Catarrhal. The correct answer is option C. Sanguinous. A drainage from a surgical incision usually proceeds from sanguinous to serosanguinous. B. Purulent drainage usually indicates infection and should not be seen initially from a surgical incision. C. Drainage from a surgical incision is initially sanguinous, proceeding to serosanguinous, and then to serous. D. Catarrh is a type of exudate seen in upper respiratory infections, not in surgical incisions. Question 5. A client had a hemicolectomy performed 2 days ago. Today, when the nurse assesses the incision, a small part of the abdominal viscera is seen protruding through the incision. This complication of wound healing is known as, here are the options. Option A, excoriation. Option B, dehiscence. Option C, degradation. Option D, evisceration. The correct answer is option D, evisceration. Excoriation is abrasion of the epidermis or of the coating of any organ of the body by trauma, chemicals, burns, or other causes. B. Dehiscence is a partial or complete separation of the wound edges with no protrusion of abdominal tissue. C. Decortication is removal of the surface layer of an organ or structure. It is a type of surgery, such as removing the fibrinous peel from the visceral pleura in thoracic surgery. Devisceration occurs when the incision separates and the contents of the cavity spill out. Question 6. The nurse documents a client's surgical incision as having red granulated tissue. This indicates that the wound is, here are the options. Option A, infected. Option B, not healing. Option C, necrotic. Option D, healing. The correct answer is option D, healing. The wound is not infected. An infected wound would contain pus, debris, and exudate. B. The wound is healing properly. C. A necrotic wound would appear black or brown. D. The wound is healing properly and is filled with red granulated tissue and fragile capillaries. Question 7. A client has returned to the unit following a left femoral popliteal bypass graft. 6 hours later, his dorsalis pedis pulse cannot be palpated, and his foot is cool and dusky. The nurse should, here are the options. Option A, continue to monitor the foot. Option B, notify the physician immediately. Option C, reposition and reassess the foot. Option D, assure the client that his foot is fine. The correct answer is option B, notify the physician immediately. The client is losing blood supply to his left foot. Continuing to monitor the foot will not help restore the blood supply to the foot. B. The physician should be notified immediately because the client is losing blood supply to his left foot and is in danger of losing the foot and slash or leg. C. The presenting symptoms are of an emergency nature and require immediate intervention. D. This action would be giving the client false assurance. Question 8. A client is to have a coronary artery bypass graft performed in the morning using a saphenous vein. He wants to know why the physician does not use the internal mammary artery for his bypass graft because his friend's physician uses this artery. The nurse tells the client that the internal mammary artery, here are the options. Option A, takes more time to remove. Option B, has a greater risk of becoming reoccluded. Option C, is smaller in diameter. Option D, has too many valves. The correct answer is option A, takes more time to remove. It does take more time to remove the internal mammary artery, and this is one reason why some physicians do not use it. B. There is not a greater risk of reocclusion. In fact, it may actually stay patent longer. C. The internal mammary artery is actually larger in diameter than the saphenous vein. D. The internal mammary artery does not have too many valves. Question 9. A client returns to the cardiovascular intensive care unit following his coronary artery bypass graft. In planning his care, the most important electrolyte the nurse needs to monitor will be. Here are the options. Option A, chloride. Option B, HCO3. Option C, potassium. Option D, sodium. The correct answer is option C, potassium. A chloride, HCO3, and sodium will need to be monitored, but monitoring these electrolytes is not as important as potassium monitoring. B chloride, HCO3, and sodium will need to be monitored, but monitoring these electrolytes is not as important as potassium monitoring. C potassium will need to be closely monitored because of its effects on the heart. Hypokalemia could result in supraventricular tachyarrhythmias. D chloride, HCO3, and sodium will need to be monitored, but monitoring these electrolytes is not as important as potassium monitoring. Question 10. A client is being discharged from the hospital today. The discharge teaching for care of her colostomy included which of the following basic principles for protecting the skin around her stoma? Here are the options. Option A, taping a pouch that is leaking. Option B, cutting the skin barrier 11/2 inches larger than the stoma. Option C, changing the pouch only when leakage occurs. Option D, using a skin sealant under pouch adhesives. The correct answer is option D, using a skin sealant under pouch adhesives. When a pouch seal leaks, the pouch should be immediately changed, not taped. Stool held against the skin can quickly result in severe irritation. B. The skin barrier should be cut only slightly larger than the stoma 1/2 inch. C. The client should be taught to change pouches whenever possible before leakage occurs. D. When skin sealant is used under the tape, the outermost layer of the epidermis remains intact. When no skin sealant is used, this layer is removed when the tape is removed. Question 11. A client is being discharged from the hospital tomorrow following a colon resection with a left colostomy. The nurse knows that the client understands the discharge teaching about care of her colostomy when she says, here are the options. Option A, I know that I am not supposed to irrigate my colostomy. Option B, my stool will be soft like paste. Option C, my stoma should be red and slightly raised. Option D, the skin around my stoma may become irritated from the enzymes in my stool. The correct answer is option C. My stoma should be red and slightly raised. A left colostomy indicates an ascending colon resection. This type of colostomy can be irrigated. B. The stool from an ascending colon resection should be formed. C. The healthy stoma should be red and slightly raised. If it begins to turn dark or blue, the client should see the physician immediately. D. The stool in the ascending colon does not usually have many enzymes in it. Stool from an ileostomy has more enzymes and is more irritating to the skin. Question 12. A client had a right below the knee amputation 4 days ago. He is complaining of pain in his right lower leg. The nurse should, here are the options. Option A, remind the client that he no longer has that part of his leg and assure him he will be okay. Option B, call the physician to request a psychological consultation for the client. Option C, turn on the television to distract the client's attention from his amputated leg. Option D, give the client his order of Demerol 50 mg IMP-RN. The correct answer is option D. Give the client his order of Demerol 50 mg IMP-RN. The nurse is ignoring the client's pain. Telling the client that he will be okay will not relieve his phantom pain. B. The client does not need a psychological consultation. Phantom pain is a normal sensation experienced by clients with amputations. C. Using the television as a distractor will not relieve the client's phantom pain. D. Phantom pain is a normal, very real experience for an amputee and should be treated with pain medication. Question 13. A client has returned to the unit from the recovery room after having a thyroidectomy. The nurse knows that a major complication after a thyroidectomy is. Here are the options. Option A. Respiratory obstruction. Option B. Hypercalcemia. Option C. Fistula formation. Option D. Myxedema. The correct answer is option A. Respiratory obstruction. A respiratory obstruction due to edema of the glottis, bilateral laryngeal nerve damage, or tracheal compression from hemorrhage is a major complication after a thyroidectomy. B. Hypocalcemia accompanied by tetany from accidental removal of one or more parathyroid glands is a major complication, not hypercalcemia. C. Fistula formation is not a major complication associated with a thyroidectomy. It is a major complication with a laryngectomy. D. Myxedema is hypothyroidism that occurs in adults and is not a complication of a thyroidectomy. A thyroidectomy client tends to develop thyroid storm, which is excess production of thyroid hormone. Question 14. A client had a transurethral resection of the prostate yesterday. He is concerned about the small amount of blood that is still in his urine. The nurse explains that the blood in his urine. Here are the options. Option A. Should not be there on the second day. Option B. Will stop when the Foley catheter is removed. Option C. Is normal and he need not be concerned about it. Option D. Can be removed by irrigating the bladder. The correct answer is option C. Is normal and he need not be concerned about it. Some hematuria is usual for several days after surgery. B. The client will continue to have a small amount of hematuria even after the Foley catheter is removed. C. Some hematuria is usual for several days after surgery. The client should not be concerned about it unless it increases. D. Irrigating the bladder will not remove the hematuria. Irrigation is done to remove blood clots and facilitate urinary drainage. Question 15. A 72-year-old male client had the Foley catheter that was inserted during the transurethral resection of his prostate removed today. He is concerned about the urinary incontinence he is having since removal of the Foley catheter. The nurse explains that. Here are the options. Option A. He should not be concerned about it because it will resolve quickly. Option B. This is usually temporary. Option C. The nurse will keep him dry, and he should notify the nurse when this happens. Option D. This is related to the bladder spasms and will soon stop. The correct answer is option B. This is usually temporary. This problem is temporary, but it may take some time to resolve, especially in an older man. B. This problem is usually temporary, but it may take some time to resolve. C. Keeping the client dry will not relieve his anxiety about his incontinence. D. The bladder spasms are not the cause of the client's incontinence. Question 16. A 48-year-old female client is going to have a cholecystectomy in the morning. In planning for her post-operative care, the nurse is aware that a priority nursing diagnosis for her will be high risk for. Here are the options. Option A. Knowledge deficit. Option B. Urinary retention. Option C. impaired physical mobility. Option D, ineffective breathing pattern. The correct answer is option D, ineffective breathing pattern. The client may have a knowledge deficit, but reducing the risk for knowledge deficit is not a priority nursing diagnosis postoperatively. B, the client will have a Foley catheter for a day or two after surgery. Urinary retention is usually not a problem once the Foley catheter is removed. C, a client having a cholecystectomy should not be physically impaired. In fact, the client is encouraged to begin ambulating soon after surgery. D, because of the location of the incision, the client having a cholecystectomy is reluctant to breathe deeply and is at risk for developing pneumonia. These clients have to be reminded and encouraged to take deep breaths. Question 17. A client is having a pneumonectomy done today, and the nurse is planning her postoperative care. Nursing interventions for postoperative left pneumonectomy would include, here are the options. Option A, monitoring the chest tubes. Option B, positioning the client on the right side. Option C, positioning the client in semi-Fowler position with a pillow under the shoulder and back. Option D, monitoring the right lung for an increase in rales. The correct answer is option D, monitoring the right lung for an increase in rales. Chest tubes are usually not necessary in a pneumonectomy because there is no lung to re-expand on the operative side. B, the pneumonectomy client should be positioned on the back or operated side because the sutured bronchial stump may open, allowing fluid to drain into the unoperated side and drown the client. C, the client should not have a pillow under the shoulder and back because of the subscapular incision. D, rales are commonly heard over the base of the remaining lung, but an increase could indicate circulatory overload and therefore should be closely monitored. Question 18. A client returned to the unit following a pneumonectomy. As the nurse is assessing her incision, she notices fresh blood on the dressing. The nurse should first, here are the options. Option A, reinforce the dressing. Option B, continue to monitor the dressing. Option C, notify the physician. Option D, note the time and amount of blood. The correct answer is option C, notify the physician. The dressing should not be reinforced without first notifying the physician. The decision may be made by the physician to reinforce the dressing after assessing the amount of bleeding. B, blood on the dressing is unusual and should make the nurse aware that something more than continuing to monitor the dressing should be done. C, the physician should be notified immediately because if the bleeding persists, the client may have to be taken back to surgery. D, the time and amount of blood do need to be recorded after the physician is notified. Question 19. A client had a renal transplant 3 months ago. He has suddenly developed graft tenderness, an increased white blood cell count, and malaise. The client is experiencing which type of rejection? Here are the options. Option A, acute. Option B, chronic. Option C, hyperacute. Option D, hyperchronic. The correct answer is option A, acute. The sudden development of fever, graft tenderness, increased white blood count, and malaise are signs and symptoms of an acute rejection that commonly occurs at 3 months. B, chronic rejection occurs slowly over a period of months to years and mimics chronic renal failure. C, hyperacute rejection occurs immediately after surgery up to 48 hours postoperatively. D, hyperchronic rejection is not a type of rejection. Question 20. A client has received preoperative teaching for the vertical partial laryngectomy that he is scheduled to have in the morning. The nurse determines that the teaching has been effective when the client states, "Here are the options." Option A. I know I will need special swallowing training after my surgery. Option B. The quality of my voice will be excellent after surgery. Option C. I will have very little difficulty swallowing after surgery. Option D. I may also have to have a radical neck dissection done. The correct answer is option C. I will have very little difficulty swallowing after surgery. A client with a supraglottic horizontal partial laryngectomy would require special swallowing training, not a vertical partial laryngectomy. B. The quality of the client's voice will be altered, but adequate for communication. C. The client will have minimal difficulty swallowing. D. A radical neck dissection may be done with a total laryngectomy, but not with a partial laryngectomy. Question 21. A client is having a vertical partial laryngectomy, and the nurse is planning his postoperative care. A priority postoperative nursing diagnosis for a client having a vertical partial laryngectomy would be, here are the options. Option A. Activity intolerance. Option B. Ineffective airway clearance. Option C. High risk for infection. Option D. Altered oral mucous membrane. The correct answer is option B. Ineffective airway clearance. The laryngectomy client should be able to gradually increase activities without difficulty. B. The laryngectomy client may have copious amounts of secretions and require suctioning for the first 24 to 48 hours. The cannula will require cleaning even after the first 24 hours because mucus collects in it. C. The client does have a potential for infection, but it is not a more important nursing priority than the ineffective airway clearance. D. This problem is not a more important nursing priority than ineffective airway clearance. The client's mouth may become dry, but good oral care should take care of the dryness. Question 22. A client is going to have a pneumonectomy in the morning. She had a previous negative surgical experience, is talking rapidly, and has an increased pulse and respiratory rate. Nursing interventions for this client should include, here are the options. Option A. Providing opportunities to ask questions and talk about concerns. Option B. Providing distractors such as reading or watching television. Option C. Telling her that she should not be so nervous and assuring her that everything will be okay. Option D. Reminding her that this surgery is not as extensive as her past surgery was. The correct answer is option A. Providing opportunities to ask questions and talk about concerns. This intervention will help to clarify any misunderstandings about the surgery and give the client an opportunity to verbalize concerns about the surgery. B. Distractors will not alleviate the preoperative anxiety that the client is experiencing. This response actually denies the client's anxiety. C. This intervention is false assurance and denies that anxiety is a normal response to the threat of surgery. D. Psychological responses are not directly related to the extent of the surgery because they are influenced by the client's past experiences. Question 23. On admission to the inpatient unit, a 34-year-old client is able to follow simple directions, but with great difficulty. He is worried about how he can keep clean in such a public place and repeatedly dusts his bureau, straightens his bed, and adjusts the clothes in his closet. The client is experiencing a severe level of anxiety. Which response by the nurse would be most therapeutic in initially attempting to reduce his anxiety? Here are the options. Option A. You will not be allowed to remain in your room if you continue to bother things. Option B. I can see how uncomfortable you are, but I would like you to walk with me so I can show you around the unit. Option C. Tell me why your room needs to be so clean. Option D. I've inspected this room and it is perfectly clean. The correct answer is option B. I can see how uncomfortable you are, but I would like you to walk with me so I can show you around the unit. This statement is punitive. B. Acknowledging the anxiety and channeling it into some positive activity is therapeutic. C. The client cannot say why. This statement puts the client on the defensive. D. A rational approach, especially a judgmental one, is non-therapeutic. Question 24. The physician prescribes amitriptyline Elavil for a client. What does the patient need to know about this medication? Here are the options. Option A. Prolonged use of this medication will result in extrapyramidal side effects. Option B. When the medication is effective, he will experience no anxiety. Option C. The medication should relieve his symptoms of depression. Option D. Blood must be drawn weekly to test for toxicity. The correct answer is option C. The medication should relieve his symptoms of depression. Phenothiazines cause extrapyramidal symptoms. B. No amount of medication can relieve all anxiety in all cases. C. The purpose of amitriptyline is to relieve the symptoms of depression because it is an antidepressant. It increases the action of norepinephrine and serotonin on nerve cells. D. Periodic blood tests are done when lithium is prescribed. Question 25. The health team needs to realize that the compulsive concern with cleanliness that a client with severe anxiety exhibits is most likely an attempt to. Here are the options. Option A. Reduces anxiety. Option B. Avoid going to psychotherapy. Option C. Manipulate the health team members. Option D. Increase his self-image by showing higher standards than the fellow clients. The correct answer is option A. Reduce his anxiety. These behaviors are attempts to relieve anxiety. B. Avoidance is not a pattern in the obsessive client. C. Although these behaviors may seem to manipulate others, that is not the purpose behind the activity. D. Inflated self-esteem is not a characteristic of the severely anxious client. Question 26. A successful executive left her job and became a housewife after her marriage to a plastic surgeon. She started doing volunteer work for a charity organization. She developed pain in her legs that advanced to the point of paralysis. Her physicians can find no organic basis for the paralysis. The client's behavior can be described as, here are the options. Option A. Housework phobia. Option B. Malingering. Option C. Conversion reaction. Option D. Agoraphobia. The correct answer is option C. Conversion reaction. A typical phobia does not result in physical symptoms, i.e. paralysis. B. Malingering is pretending to be ill. This person has a true paralysis. C. A conversion reaction is a physical expression of an emotional conflict. It has no organic basis. D. Agoraphobia is fear of public places. Question 27. A 28-year-old client performs a long, involved ritual in getting up and preparing for the day. He became unable to get to his job before noon. His family, in desperation, has admitted him to the hospital's psychiatric unit. On the unit, he is always late for breakfast, which is served at 8 a.m. The nurse identifies that the best approach to this problem is to. Here are the options. Option A. Allow him to eat late. Option B. Suggest that he do the rituals after breakfast. Option C. Get him up early so that he can complete the ritual before breakfast. Option D. Ask him to get all the other clients up so that he will forget about his ritual. The correct answer is option C. Get him up early so that he can complete the ritual before breakfast. Allowing him to eat late is not a solution to the problem because the ritual affects more than just this meal. B. He is helpless to change this behavior because the rituals occur as a result of an irrational effort to control his anxiety. C. To interfere with the ritual will increase anxiety. Until the basic problem is resolved and in turn his need for the ritual relieved, arrange the schedule so that essential activities may be included such as meals with the group. D. This approach would be very disruptive to the other clients and would not serve to relieve the anxiety of the client. Question 28. A 25-year-old lawyer who is married with 3 young children works long hours in an effort to become a partner in the law firm. Following a recent hospitalization for a bleeding ulcer, he was referred for therapy to treat this psychophysiological disorder. On meeting with the therapist, he informed him or her that he was a busy man and did not have much time for this psych stuff. When guiding the client to ventilate his feelings, the therapist can expect him to express feelings of, here are the options. Option A. Guilt. Option B. Shame. Option C. Despair. Option D. Anger. The correct answer is option D. Anger. A guilt relates to depression. B. Shame is not associated with psychophysiological disorders. C. Despair relates to depression. D. Repressed anger is associated with psychophysiological disorders. Question 29. Plans for the care of a client with an ulcer caused by emotional problems need to take into consideration that, here are the options. Option A. His priority needs are limited to medical management. Option B. There is no real psychological basis for his illness. Option C. The disorder is a threat to his physical well-being. Option D. He is unable to participate in planning his care. The correct answer is option C. The disorder is a threat to his physical well-being. There may be a medical emergency that takes top priority. However, the basis of the problem is emotional. B. The problem is a physical manifestation of an emotional conflict. C. The bleeding ulcer can be life-threatening. D. For lifestyle change to occur, the client must participate in the planning of his care so that he is committed to changes that will have positive results. Question 30. A client has been uncomfortable in crowds all her life. After the birth of her child, she has been housebound unless her husband can accompany her to the grocery store and for medical appointments. His schedule will not allow for this, and he has insisted that she must be more independent. Her anxiety has increased to the point of panic. The client has been diagnosed with agoraphobia. Which statement is true about this disorder? Here are the options. Option A. The behavior is not considered disabling. Option B. More men suffer from agoraphobia than women. Option C. The fears are persistent and avoidance is used as the coping mechanism. Option D. Agoraphobia moves into remission when treated with chlorpromazine. The correct answer is option C. The fears are persistent, and avoidance is used as the coping mechanism. Agoraphobia is the most pervasive and serious phobic disorder. B. Women compose 70%–85% of agoraphobia sufferers. C. Agoraphobia is an acute disorder that immobilizes the sufferer with extreme anxiety. D. Chlorpromazine is not a drug used to treat phobias. Question 31. A 22-year-old single woman was admitted to the psychiatric hospital by her mother, who reported bizarre behavior. Except for going to work, she spends all her time in her room and expresses concern over neighbors spying on her. She has fears of the telephone being bugged. Her diagnosis is schizophrenia. One nurse per shift is assigned to work with the client. The primary reason for this plan would be to. Here are the options. Option A. Protect her from suicide. Option B. Enable her to develop trust. Option C. Supervise her medication regimen. Option D. Involve her in groups for social interaction. The correct answer is option B. Enable her to develop trust. A suicide is a greater risk in depression than in schizophrenia. B. The client is suspicious and needs help to develop trust, which is basic to her improvement. C. Although she will be taking medication, drug therapy would not necessitate consistency in the nurses assigned. D. A suspicious client should have limited exposure to groups because group participation increases discomfort. Question 32. The 4th of July holiday comes while a client is in the hospital being treated for schizophrenia. She is taking chlorpromazine and has improved to the point of being allowed to go with a group to the park for a picnic. The side effect of chlorpromazine that the nurse needs to keep in mind during this setting is, here are the options. Option A. Hypotension. Option B. Photosensitivity. Option C. Excessive appetite. Option D. Dryness of the mouth. The correct answer is option B. Photosensitivity. A decrease in blood pressure sometimes occurs with chlorpromazine. It would not be a factor influenced by a picnic in the park. B. Protection from the sun is important in clients taking phenothiazines because they burn easily and severely. C. An appetite increase sometimes occurs with chlorpromazine. It would not be affected by a picnic. D. Dryness of the mouth may occur at any time and is not affected by the picnic outing. Question 33. Except for initial explosiveness on admission, a client diagnosed with schizophrenia stays in her room. She continues to believe other people are out to get her. A nursing intervention basic to improving withdrawn behavior is, here are the options. Option A. Assigning her to occupational therapy. Option B. Having her sit with the nurses while they chart. Option C. Helping her to make friends. Option D. Facilitating communication. The correct answer is option D. Facilitating communication. The nurse does not make this assignment. B. One-to-one observation is not appropriate. It does not focus on the client or encourage communication. C. The client is too suspicious to accomplish this goal. D. The withdrawn individual must learn to communicate on a one-to-one level before moving on to more threatening situations. Question 34. A 32-year-old mother of two was brought to the hospital by her husband. He reported that his wife could no longer manage the house and children. She does not sleep and talks day and night. She has purchased some very expensive clothes. The nurse noted that the client speaks rapidly and changes the subject irrationally. This is an example of, here are the options. Option A. Flight of ideas. Option B. Delusions. Option C. Hallucinations. Option D. Echolalia. The correct answer is option A. Flight of ideas. A rapidly moving from one topic to another without following any logical sequence is called flight of ideas. B. False beliefs are delusions. C. False sensory perceptions are hallucinations, hearing voices. D. Repeating words is called echolalia. Question 35. A client is placed on lithium therapy for her manic depressive illness. When monitoring the client, the nurse assesses the laboratory blood values. Toxicity may occur with lithium therapy when the blood level is above. Here are the options. Option A, 1.0 mg/L. Option B, 2.2 mg/L. Option C, 0.03 mg/L. Option D, 1.5 mg/L. The correct answer is option D, 1.5 mg/L. This value is a low blood level. B. This value is a toxic blood level. C. This value is a low blood level. D. This value is the level at which most clients are maintained, and toxicity may occur if the level increases. The client should be monitored closely for symptoms because some clients become toxic even at this level. Question 36. A client's behavior is annoying other clients on the unit. He is meddling with their belongings and dominating the group. The best approach by the nurse is to, here are the options. Option A, seclude him in his room. Option B, set limits on his behavior. Option C, have his medication increased. Option D, ignore him and tell the other clients that these behaviors are due to his illness and that they should understand. The correct answer is option B, set limits on his behavior. This action by the nurse would be punitive. B. Consistent limit setting will help the client to know what is acceptable behavior. C. This action is not within the nurse's scope of practice. D. This could be dangerous to the client and to others and violates other clients' rights. Question 37. A client is hyperactive and not sleeping. She will not remain at the table during mealtime. She is getting very limited calories and is using a lot of energy in her hyperactive state. The most therapeutic nursing action is to, here are the options. Option A, insist that she remain at the table and eat a balanced diet. Option B, order a high-calorie diet with supplements. Option C, provide nutritious finger foods several times a day. Option D, offer to go to the dining room with her and allow her to open the food and inspect what she eats. The correct answer is option C. Provide nutritious finger foods several times a day. The client is not able to sit for long periods. Forcing her to remain at the table will increase her anxiety and cause her to become hostile. B. This action will not ensure that the client eats what is ordered. Dietary orders are not within the nurse's scope of practice. C. Providing finger foods increases the likelihood of eating for hyperactive persons. They may be eating on the run. D. These clients are not suspicious of the food or insecure in moving about the unit alone. Question 38. A hyperactive client is experiencing flight of ideas. The most therapeutic activity for him would be, here are the options. Option A, doing crafts and occupational therapy. Option B, working a 1,000-piece puzzle. Option C, playing bridge with 3 other clients. Option D, playing basketball in the gym. The correct answer is option D, playing basketball in the gym. This activity requires motor skills and therefore would be difficult for a hyperactive client. B. This activity would take too long, and the client would have difficulty concentrating owing to a limited attention span. C. This client would not be able to concentrate enough to play card games. He would respond to all the stimuli in the area, become distracted, and leave the table. D. This activity would allow the client to channel his energy in a positive way. Question 39. A client is a depressed, 48-year-old salesman. A serious concern for the nurse working with depressed clients is the potential of suicide. The time that suicide is most likely to occur is. Here are the options. Option A. In the acutely depressed state. Option B. When the depression starts to lift. Option C. In the denial phase. Option D. During a manic episode. The correct answer is option B. When the depression starts to lift. The client may be too disorganized in the acute phase to make a workable plan. B. When the depression starts to lift, the client is able to make a workable plan. C. There usually is not a significant denial phase related to depression. Suicide occurs in a state of despair and hopelessness. D. Suicide is uncommon in the manic state. In this state, clients do not feel hopeless, but euphoric and overly confident. Question 40. Succinylcholine chloride (ANCTine) is ordered prior to electroconvulsive therapy treatment for depressed clients. The nurse explains that the purpose of the drug is to. Here are the options. Option A. Relax muscles. Option B. Relieve anxiety. Option C. Reduce secretions. Option D. Act as an anesthetic. The correct answer is option A. Relax muscles. A succinylcholine chloride relaxes muscles and decreases the intensity of the seizure. B. Succinylcholine chloride does not relieve anxiety. C. Atropine is given to reduce secretions. D. Thiamyl sodium certyl or other phenobarbital preparations are used as brief anesthetics. Question 41. The nurse teaches a pregnant client that a high-risk symptom occurring at any time during pregnancy that needs to be reported immediately to a healthcare provider is. Here are the options. Option A. Constipation. Option B. Urinary frequency. Option C. Breast tenderness. Option D. Abdominal pain. The correct answer is option D. Abdominal pain. A constipation is a result of decreased peristalsis due to smooth muscle relaxation related to changing progesterone levels that occurred during pregnancy. B. Urinary frequency is a common result of the increasing size of the uterus and the resulting pressure it places on the bladder. C. With the increased vascularity and hypertrophy of the mammary alveoli due to estrogen and progesterone level changes, the breasts will increase in size and may become tender. D. Abdominal pain may be an indication of early spontaneous abortion, preterm delivery, or a placental abruption. Question 42. At her first prenatal visit, a 21-year-old woman who is gravid 2, para0, AB1, is currently at 32 weeks gestation and has a history of drug abuse, smoking, and occasional ethyl alcohol use. Fetal ultrasound tests indicate poor fetal growth. The most likely reason for the infant's intrauterine growth retardation is. Here are the options. Option A. The client's young age. Option B. The client's previous abortion. Option C. The client's history of drug, ethyl alcohol, and tobacco use. Option D. The client's late prenatal care. The correct answer is option C. The client's history of drug, ethyl alcohol, and tobacco use. Although adolescents frequently have a higher incidence of low birth weight infants, this client is 21 years old. B. Uncomplicated induced abortions have not been proved to influence the growth of infants of subsequent pregnancies. C. Compounds in cigarettes and some illicit drugs cause maternal vasoconstriction and a subsequent reduction in O2 availability for the fetus owing to the resulting reduction in utero-placental blood flow. As few as 1 or 2 drinks of alcohol per day will decrease birth weight. D. Although early prenatal care has been shown to improve pregnancy outcomes, not seeking care until the second week of gestation does not, in and of itself, cause intrauterine growth retardation. Question 43. When teaching a class of nursing students, the nurse asks why the embryonic period weeks 48 of pregnancy is so critical. Here are the options. Option A. Duplication of genetic information takes place. Option B. Organogenesis occurs. Option C. Subcutaneous fat builds up steadily. Option D. Kidneys begin to secrete urine. The correct answer is option B. Organogenesis occurs. A duplication of genetic material occurs during the pre-embryonic period weeks 13 following conception. The exact duplication of genetic material is essential for cell differentiation, growth, and biological maintenance of the organism. B. Weeks 48, known as the embryonic period, are the time organogenesis occurs and pose the greatest potential for major congenital malformations. All major internal and external organs and systems are formed. C. Subcutaneous fat does not develop until the latter weeks of gestation. D. Kidneys begin to secrete urine during the 13th-16th week. Question 44. What specific hormone must be present in serum or urine laboratory tests used to diagnose pregnancy? Here are the options. Option A. Human chorionic gonadotropin. Option B. Estrogen. Option C. Theta protein. Option D. Sphingomyelin. The correct answer is option A. Human chorionic gonadotropin. A human chorionic gonadotropin is the biochemical basis for pregnancy tests. It is produced by the placenta to help maintain the corpus luteum. Its levels climb rapidly following conception, peaking at about 8 weeks and then gradually decreasing to low levels after 16 weeks. B. Estrogen does steadily rise throughout pregnancy, increasing to 30 times that of pre-pregnancy levels. Although estrogen levels do change during pregnancy, it is not used as the main hormone of evaluation in pregnancy tests. C. Theta protein is the major protein in the serum of the embryo. It is initially produced by the yolk sac. D. Lecithin and sphingomyelin are 2 phospholipids of which fetal lung surfactant is composed. Levels are evaluated to determine fetal lung maturity. Question 45. A nurse is taking a maternal history for a client at her first prenatal visit. Her pregnancy test was positive. She has 2 living children, she had 1 spontaneous abortion, and 1 infant died at the age of 3 months. Which of the following best describes the client at the present? Here are the options. Option A. Gravida 4 para 2 ab 1. Option B. Gravida 5 para 3 ab 1. Option C. Gravida 5 para 4 ab 0. Option D. Gravida 4 para 3 ab 0. The correct answer is option B. Gravida 5 para 3 ab 1. This individual has been pregnant 4 times, delivered 2 children, and had 1 abortion. B. Your client has been pregnant 5 times, delivered 3 children, and had 1 abortion. C. This individual has been pregnant 5 times, delivered 4 children, and has not had an abortion. D. This individual has been pregnant 4 times, delivered 3 children, and has not had an abortion. Question 46. A client is now pregnant for the second time. Her first child weighed 436 g at delivery. The client's glucose tolerance test shows elevated blood sugar levels. Because she only shows signs of diabetes when she is pregnant, she is classified as having, here are the options. Option A, insulin-dependent diabetes. Option B, type Roman II diabetes mellitus. Option C, type I diabetes mellitus. Option D, gestational diabetes mellitus. The correct answer is option D, gestational diabetes mellitus. Insulin-dependent diabetes mellitus, also known as type I diabetes, usually appears before the age of 30 years with an abrupt onset of symptoms requiring insulin for management. It is not related to onset during pregnancy. B. Non-insulin-dependent diabetes type Roman II diabetes usually appears in older adults. It has a slow onset and progression of symptoms. C. This type of diabetes is the same as insulin-dependent diabetes. D. Gestational diabetes mellitus has its onset of symptoms during pregnancy and usually disappears after delivery. These symptoms are usually mild and not life-threatening, although they are associated with increased fetal morbidity and other fetal complications. Question 47. Prior to an amniocentesis, a fetal ultrasound is done in order to. Here are the options. Option A, evaluate fetal lung maturity. Option B, evaluate the amount of amniotic fluid. Option C, locate the position of the placenta and fetus. Option D, ensure that the fetus is mature enough to perform the amniocentesis. The correct answer is option C, locate the position of the placenta and fetus. A amniocentesis can be performed to assess for lung maturity. Fetal ultrasound can be used for gestational dating, although it does not separately determine lung maturity. B. Ultrasound can evaluate amniotic fluid volume, which may be used to determine congenital anomalies. C. Amniocentesis involves removal of amniotic fluid for evaluation. The needle, inserted through the abdomen, is guided by ultrasound to avoid needle injuries, and the test evaluates the position of the placenta and the fetus. D. Amniocentesis can be performed as early as the 15th-17th week of pregnancy. Question 48. A 17-year-old pregnant client who is gravida 1, perio, is at 36 weeks gestation. Based on the nurse's knowledge of the maternal physiological changes in pregnancy, which of these findings would be of concern? Here are the options. Option A, complaints of dyspnea. Option B, edema of face and hands. Option C, pulse of 65 bpm at 8 weeks, 73 bpm at 36 weeks. Option D, hematocrit 39%. The correct answer is option B, edema of face and hands. A dyspnea is a common complaint during the third trimester owing to the increasing size of the uterus and the resulting pressure against the diaphragm. B. Edema of the face, hands, or pitting edema after 12 hours of bed rest may be indicative of preeclampsia and would be of great concern to the healthcare provider. C. An increase in heart rate of 1015 bpm is a normal physiological change in pregnancy due to the multiple hemodynamic changes. D. A hematocrit value of 39% is within the normal range. A value 35% would indicate anemia. Question 49. Based on your knowledge of genetic inheritance, which of these statements is true for autosomal recessive genetic disorders? Here are the options. Option A, heterozygotes are affected. Option B. The disorder is always carried on the X chromosome. Option C. Only females are affected. Option D. Two affected parents always have affected children. The correct answer is option D. Two affected parents always have affected children. The term heterozygote refers to an individual with one normal and one mutant allele at a given locus on a pair of homologous chromosomes. An individual who is heterozygous for the abnormal gene does not manifest obvious symptoms. B disorders carried on either the X or Y sex chromosome are referred to as sex-linked recessive. C. Either sex may be affected by autosomal recessive genetic disorders because the responsible allele can be on any one of the 46 chromosomes. D. If both parents are affected by the disorder and are not just carriers, then all their children would manifest the same disorder. Question 50. Choriomyelitis is a maternal infection that is usually associated with, here are the options. Option A. Prolonged rupture of membranes. Option B. Postpartum deliveries. Option C. Maternal pyelonephritis. Option D. Maternal dehydration. The correct answer is option A. Prolonged rupture of membranes. A choriomyelitis is an inflammation of the chorion and amnion that is generally associated with premature or prolonged rupture of membranes. B. Postpartum deliveries have not been shown to increase the risk of choriomyelitis unless there has been prolonged rupture of membranes. C. Pyelonephritis is a kidney infection that develops in 20%–40% of untreated maternal UTIs. D. Maternal dehydration, though of great concern, is not related to choriomyelitis. Question 51. A client has been diagnosed with thrombophlebitis. She asks, "What is the most likely cause of thrombophlebitis during my pregnancy?" The nurse explains, here are the options. Option A. Increased levels of the coagulation factors and a decrease in fibrinolysis. Option B. An inadequate production of platelets. Option C. An inadequate intake of folic acid during pregnancy. Option D. An increase in fibrinolysis and a decrease in coagulation factors. The correct answer is option A. Increased levels of the coagulation factors and a decrease in fibrinolysis. During pregnancy, the potential for thrombosis increases owing to the increased levels of coagulation factors and a decrease in the breakdown of fibrin. B. An inadequate production of platelets would result in thrombocytopenia with resulting signs and symptoms of bleeding such as petechiae, hematuria, or hematemesis. C. A deficiency of folic acid during pregnancy produces a megaloblastic anemia. It is usually found in combination with iron deficiency. D. This combination would result in bleeding disorders because more fibrin would be broken down and fewer clotting factors would be available. Question 52. Following the delivery of a healthy newborn, a client has developed thrombophlebitis and is receiving heparin Roman 4. What are the signs and symptoms of a heparin overdose for which the nurse would need to observe during postpartum care of the client? Here are the options. Option A. Dysuria. Option B. Epistaxis, hematuria, dysuria. Option C. Vertigo, hematuria, ecchymosis. Option D. Hematuria, ecchymosis, and epistaxis. The correct answer is option D. Hematuria, ecchymosis, and epistaxis. A dysuria is not a common symptom of heparin overdose. B. Although epistaxis and hematuria are common symptoms of heparin overdose, dysuria is not. C. Vertigo is not a common symptom of heparin overdose. D. Hematuria, ecchymosis, and epistaxis are the most common signs and symptoms of a heparin overdose. Others are thrombocytopenia, elevated liver enzymes, and local injection site complications. Question 53. A client who is a breastfeeding mother develops mastitis. The clinical signs and symptoms of mastitis include, here are the options. Option A. Marked engorgement, elevated temperature, chills, and breast pain with an area that is red and hardened. Option B. Marked engorgement and breast pain. Option C. Elevated temperature and general malaise. Option D. Cracked nipple with complaints of soreness. The correct answer is option A. Marked engorgement, elevated temperature, chills, and breast pain with an area that is red and hardened. A mastitis is a bacterial inflammation of the breast tissue found primarily in breastfeeding mothers. The bacteria usually enter the breast through a cracked nipple, or the infection results from stasis of milk behind a blocked duct. B. With breast engorgement during breastfeeding, there may be marked breast pain. This is not necessarily a sign of infection. C. Women may become ill during breastfeeding with other bacterial or viral infections that are not related to mastitis. D. Improper care of the nipples or improper positioning of the infant during breastfeeding may result in cracked or sore nipples. Question 54. A 34-year-old client who is Gravida 1, Para 0 has a history of infertility and conceived this pregnancy while taking fertility drugs. She is at 32 weeks gestation and is carrying triplets. She is complaining of low back pain and a feeling of pelvic pressure. Her cervical exam reveals a long, closed cervix. The nurse notes that the client is experiencing mild uterine contractions every 78 minutes after the nurse has placed her on the fetal monitor. Her condition should indicate that, here are the options. Option A. Her cervix shows she will likely deliver soon. Option B. The nurse should not be alarmed because mild uterine activity is common at 32 weeks gestation. Option C. She may be in preterm labor because this is more common with multiple pregnancies. Option D. She most likely has a urinary tract infection UTI because this is common with pregnancy. The correct answer is option C. She may be in preterm labor because this is more common with multiple pregnancies. Her cervical exam is normal. There are no cervical changes at this time. B. Braxton Hicks contractions may be common throughout pregnancy, but they are not regular. C. Rhythmical contractions in conjunction with low back pain and pelvic pressure at 32 weeks in a woman carrying triplets are of great concern. She may be in preterm labor. D. UTIs are common in pregnancy due to the enlarging uterus compressing the ureters and the stasis of urine. The woman would be more likely to complain of urinary frequency and urgency, fever or chills, and malodorous urine with a UTI. Question 55. The most frequent cause of early postpartum hemorrhage is, here are the options. Option A. Hematoma. Option B. Coagulation disorders. Option C. Uterine. Option D. Retained placental fragments. The correct answer is option C. Uterine. Hematomas, which are the result of damage to a vessel wall without laceration of the tissue, are a cause, though not the most frequent cause. B. Coagulation disorders are among the causes of postpartum hemorrhage, but they are less common. C. The most frequent causes of hemorrhage in the postpartum period are related to an interference with involution of the uterus. Uterine atony is the most frequent cause, occurring in the first 24 hours after delivery. Retained placental fragments are also a cause, although these bleeds usually occur 714 days after delivery. Question 56. A client has just been transferred to the floor from the labor and delivery unit following delivery of a stillborn-term infant. She is very despondent. When the nurse attempts to take her vital signs, she responds in anger, stating, "You leave me alone. You don't care anything about me. It's people like you who let my baby die." The nurse's best course of action is to, here are the options. Option A, quietly leave her room, allowing her more private time to deal with her loss. Option B, tell her that what happened was for the best and that she is still young and can have other children. Option C, tell her how sorry you are and let her know that her child is now a little angel in heaven. Option D, tell her how sorry you are about the loss of her baby and acknowledge her anger as being a normal stage of grief. Assure her that you are there to help her in any way you can. The correct answer is option D. Tell her how sorry you are about the loss of her baby and acknowledge her anger as being a normal stage of grief. Assure her that you are there to help her in any way you can. Parents do need their privacy following a loss, but the nurse still has a responsibility to provide postpartum physical care. B. This is a negative statement, which is not therapeutic. The client is not concerned about future children, but is in the first stages of grief, denial, and anger. C. This is a negative statement, which is not therapeutic. The client does not want to hear about her baby in heaven. She cannot believe that God could love or want her child more than she could. D. Acknowledging that anger is normal and beneficial will help the client to understand the normal stages of grief. Expressing sorrow over her loss and assuring her that the support is there to take care of her physical and emotional needs will help to promote a trusting relationship. Question 57. When a client arrives on the labor and delivery unit, she informs the nurse that she has been having contractions for the last 5 hours. Now the pain is constant and not cyclical as it was earlier. The nurse considers the possibility of uterine rupture. Which of the following symptoms would be consistent with uterine rupture? Here are the options. Option A, a large gush of clear fluid from the vagina. Option B, systolic hypertension. Option C, abdominal rigidity. Option D, increased fetal movements. The correct answer is option C, abdominal rigidity. This symptom would indicate a rupture of the membranes, which would be expected during labor. There would be no cause for alarm if the fluid were clear. B. With uterine rupture and the risk of maternal shock secondary to blood loss, the most likely sign would be hypotension indicating hypovolemic shock. C. In the event of a uterine rupture, an abdominal examination would likely reveal rigidity or tenderness. D. The most likely finding would be a decrease in fetal movement related to fetal distress due to impaired uteroplacental blood flow. Maintaining the client on her left side would help to maximize uterine blood flow. Question 58. A mother called the physician's office to ask if it would help relieve her small daughter's abdominal pain if she gave an enema and placed a heating pad on the abdomen. Her daughter has a fever and has vomited twice. The nurse's response is based on the knowledge that, here are the options. Option A, the symptoms could easily have been caused by constipation, which an enema would relieve. Option B, heat would help to relax the abdominal muscles and relieve her pain. Option C, both heat and enemas stimulate intestinal motility and could increase the risk of perforation. Option D, complaints of stomachache are common in young children and are generally best ignored. The correct answer is option C. Both heat and enemas stimulate intestinal motility and could increase the risk of perforation. A constipation does not cause fever or vomiting but may cause anorexia. Risk of perforation outweighs the possible benefits of an enema. B. Heat will not relieve her symptoms but will increase intestinal motility and increase the risk of perforation. C. Heat and enemas are contraindicated where severe abdominal pain is suspected because they increase intestinal motility and the risk of perforation. D. Complaints accompanied by physical symptoms such as pain, anorexia, and fever should never be ignored. Question 59. An 8-year-old child is admitted to the hospital for surgery. She has had no previous hospitalizations, and both she and her family appear anxious and fearful. It will be most helpful for the nurse to. Here are the options. Option A. Take the child to her room and calmly and matter-of-factly begin to get her ready to go to the operating room. Option B. Take time to orient the child and her family to the hospital and the forthcoming events. Option C. Explain that as soon as the child goes to the operating room, she will have time to answer any questions the family has. Option D. Tell the child and her family that there is nothing to worry about, that the operation will not take long, and she will soon be as good as new. The correct answer is option B. Take time to orient the child and her family to the hospital and the forthcoming events. This action does nothing to prepare the child and her family for what will happen or to relieve their anxiety and fear. B. This action provides security by preparing the child and the family for what will happen and will help to relieve fear and anxiety. C. This action does nothing to help prepare the child for what will happen and does not give the parents permission to ask questions until later. D. This action provides possibly false reassurance and may prevent the child and/or the family from asking pressing questions. Question 60. Following a bicycle accident, a 12-year-old client sustained a complete fracture of the left femur. He was placed in 90-90 skeletal traction with a pin in the distal end of the femur to achieve realignment and immobilization of the left femur. When providing nursing care, it is important for the nurse to remember that, here are the options. Option A. The nurse may lift only the weights that are applying traction in order to reposition him in bed. Option B. The client will need special skin care at the pin site according to hospital policy or the physician's preference. Option C. The traction pull should result in an immediate increase in comfort and reduce the need for pain medication. Option D. The client should be discouraged from participating in self-care activities to avoid the risk of disrupting the traction. The correct answer is option B. The client will need special skin care at the pin site according to hospital policy or the physician's preference. A skeletal traction, including the weights that are applying the traction, is never released by the nurse. B. It is necessary to keep the pin site clean and free from infection. C. When first placed in traction, the client may experience increased discomfort as a result of the traction pull fatiguing the muscle. D. When the child in traction is allowed to participate in his care, it gives him a measure of control and helps him to cope with the situation. Question 61. A 10-year-old client with a pin in the right femur is immobilized in traction. He is exhibiting behavioral changes including restlessness, difficulty with problem solving, inability to concentrate on activities, and monotony. Which of the following nursing implementations would be most effective in helping him cope with immobility? Here are the options. Option A. Providing him with books, challenging puzzles, and games as diversionary activities. Option B. Allowing him to do as much for himself as he is able, including learning to do pin site care under supervision. Option C. Having a volunteer come in to sit with the client and to read him stories. Option D. Stimulating rest and relaxation by a gentle rubbing with lotion and changing the client's position frequently. The correct answer is option B. Allowing him to do as much for himself as he is able, including learning to do pin side care under supervision. These activities could be frustrating for the client if he is having difficulty with problem solving and concentration. B self-care is usually well received by the child, and it is one of the most useful interventions to help the child cope with immobility. C this may be helpful to the client if he has no visitors, but it does little to help him develop coping skills. D this will help to prevent skin irritation or breakdown related to immobility, but will not help to prevent behavioral changes related to immobility. Question 62. Following a fracture of the left femur, a client develops symptoms of osteomyelitis. During the acute phase of osteomyelitis, nursing care is directed toward. Here are the options. Option A. Moving or turning the client's left leg carefully to minimize pain and discomfort. Option B. Allowing the client out of bed only in a wheelchair or gurney to minimize weight bearing on the left leg. Option C. Providing the client with a high-protein, high-fiber diet to promote healing. Option D. Instituting physical therapy to ensure restoration of optimal functioning of the leg. The correct answer is option A. Moving or turning the client's left leg carefully to minimize pain and discomfort. Any movement of his affected limb will cause discomfort to the child. B. No weight bearing will be allowed until healing is well underway to avoid pathological fractures. C. The child will be anorexic and may experience vomiting. Diet should be simple and high caloric until appetite returns and symptoms subside. D. Physical therapy is instituted only after infection subsides. Question 63. Several months after antibiotic therapy, a child is readmitted to the hospital with an exacerbation of osteomyelitis, which is now in the chronic stage. The mother appears anxious and asks what she could have done to prevent the exacerbation. The nurse's response is based on the knowledge that chronic osteomyelitis. Here are the options. Option A. Is caused by poor physical conditions or poor nutrition. Option B. Often results from unhygienic conditions or an unclean environment. Option C. Is directly related to sluggish circulation in the affected limb. Option D. May develop from sinuses in the involved bone that retain infectious material. The correct answer is option D. May develop from sinuses in the involved bone that retain infectious material. A poor nutrition and/or poor physical conditions are factors that predispose to the development of osteomyelitis, but do not cause it. B. An unclean or unhygienic environment may predispose to the development of chronic osteomyelitis, but it does not cause an exacerbation of the previous infection. C. Sluggish circulation through the medullary cavity during acute osteomyelitis may delay healing, but it does not cause the disease to become chronic. D. Areas of sequestra may be surrounded by dense bone, become honeycombed with sinuses, and retain infectious organisms for a long time. Question 64. A 5-year-old child was recently diagnosed as having acute lymphoid leukemia. She is hospitalized for additional tests and to begin a course of chemotherapy designed to induce a remission. She is scheduled to have a bone marrow aspiration tomorrow. She has had a bone marrow test previously and is apprehensive about having another. Which of the following interventions will be most effective in relieving her anxiety? Here are the options. Option A. Explain what will take place and what she will see, feel, and hear. Option B. Remind her that she has had this procedure before and that it is nothing to be afraid of. Option C. Tell her not to worry about it, that it will be over soon and she can join her friends in the playroom. Option D. Give her a big hug and tell her that she is a big girl now, and that she will do just fine. The correct answer is option A. Explain what will take place and what she will see, feel, and hear. Even though the child has had the procedure before, she will probably need additional explanations and emotional support. B. The fact that the child has had the procedure before and possibly found it painful or uncomfortable may increase, not relieve, her stress. C. This intervention does nothing to reassure the child and may well prevent her from expressing her feelings. D. This does not prepare the child for the test and burdens her with the expectation that she act bigger and braver than she is. Question 65. Parents of children receiving chemotherapy should be warned that alopecia is a side effect and that, here are the options. Option A. Children seldom show concern about losing their hair. Option B. The hair will come out gradually and the loss will not be noticeable for some time. Option C. It is best for girls to choose a wig similar to their hairstyle and color before the hair falls out. Option D. The parents will soon get used to seeing their children without hair, and it will no longer bother them. The correct answer is option C. It is best for girls to choose a wig similar to their hairstyle and color before the hair falls out. Children may become depressed with a changed appearance and not want to look at themselves or have others see them. B. The hair will fall out in clumps, causing patchy baldness that is quite noticeable and traumatic to children and their families. C. Having a wig that looks like a girl's own hair can be a psychological boost to children and is helpful in fostering later adjustments to hair loss. D. Families may become accustomed to seeing their children without hair, but the loss is traumatic to them and will continue to bother them. Question 66. A child receiving chemotherapeutic drugs experiences a loss of appetite directly related to the therapy. Which of the following strategies should be most effective in encouraging the child to eat? Here are the options. Option A. Provide a well-balanced diet at usual times and restrict dessert if the child fails to eat well. Option B. Schedule procedures immediately after eating so that the child will not be tired or in pain at mealtime. Option C. Offer the child a diet with a wider variety of foods and with more seasoning than her usual diet. Option D. Offer the child smaller meals more frequently than usual and include as many of her favorite foods as possible. The correct answer is option D. Offer the child smaller meals more frequently than usual and include as many of her favorite foods as possible. Because the child's appetite is capricious at best, regular servings may be overwhelming. Praise the child for what is eaten. B. The child will soon learn that procedures follow meals and may play with food rather than eat it to avoid or delay the procedure. C. Young children usually do not like highly seasoned foods and may need the security of usual foods. Such a change may actually increase anorexia. D. Small servings appear more achievable to the child, and the inclusion of favorite foods can add a sense of security. Question 67. A child becomes neutropenic and is placed on protective isolation. The purpose of protective isolation is to. Here are the options. Option A. Protect the child from infection. Option B. Provide the child with privacy. Option C. Protect the family from curious visitors. Option D. Isolate the child from other clients and the nursing staff. The correct answer is option A. Protect the child from infection. The child no longer has normal white blood cells and is extremely susceptible to infection. B. There are more appropriate ways to provide privacy, and there is no need to protect the child from healthy visitors. C. Visitors and visiting hours may be at the client's and/or family's request without regard to the isolation precaution. D. The child may have strong positive relationships with other clients or staff. As long as proper precautions are observed, there is no reason to isolate her from them. Question 68. A client is experiencing mucosal cell damage secondary to chemotherapy. Because of mucosal ulcers, eating has become increasingly uncomfortable for her. Which of the following interventions would be most effective in getting her to eat? Here are the options. Option A. Local anesthetics or mouth washes applied to ulcers 30 minutes prior to meals. Option B. A bland, moist, soft diet. Option C. Staying with the client and providing distraction during meals. Option D. Cleaning the mouth carefully with lemon glycerin swabs and milk of magnesia before meals. The correct answer is option B. A bland, moist, soft diet. A local anesthetics do temporarily relieve the pain, but leave an unpleasant taste and numb feeling that are not conducive to eating. B. Such a diet is less irritating to the damaged mucosa and is easier for the child to tolerate. C. This intervention is helpful if the child has only anorexia. It does not work if the type and texture of the food increase oral discomfort. D. Lemon glycerin swabs and milk of magnesia dry the oral mucosa and should be avoided. Question 69. A 15-year-old client was diagnosed as having cystic fibrosis at 8 months of age. He is in the hospital for a course of Roman IV antibiotic therapy and vigorous chest physiotherapy. He has a poor appetite. The nurse can best help him to meet the desired outcome of consuming a prescribed number of calories by. Here are the options. Option A. Including the client in planning sessions to select the type of meal plan and foods for his diet. Option B. Working with a nutritionist to devise a diet with significantly increased calories. Option C. Selecting foods for the client's diet that are high in calories and instituting a strict calorie count. Option D. Constantly providing him with chips, dips, and candies, because the number of calories consumed is more important than the quality of foods. The correct answer is option A. Including the client in planning sessions to select the type of meal plan and foods for his diet. The adolescent knows what he likes and will be more likely to eat if he has some control over his diet. B. The nurses and nutritionist can plan an excellent diet, but it will not help the adolescent unless he eats it. C. Eating is already a chore for this client. Adding a strict calorie count could make it even more burdensome. D. Fats are particularly difficult for the cystic fibrosis client to digest. He does need a healthful diet, not just more calories. Question 70. The most appropriate method of evaluating whether the diet of a child with cystic fibrosis is meeting his caloric needs is. Here are the options. Option A. Careful monitoring of weight loss or gain. Option B. Carefully recording amounts and types of foods ingested. Option C. Keeping a strict account of the number of calories ingested. Option D. Keeping a careful account of the amount of pancreatic enzymes ingested. The correct answer is option A. Careful monitoring of weight loss or gain. A consistent weight gain, even if it is slow, is an indication that the child is eating and digesting sufficient calories. B. Recording how much the child eats is useful, but it is not an indicator of how well his body is using the foods consumed. C. Counting calories will indicate how much he is eating, but it will not reflect whether or not the foods are properly digested. D. Keeping track of the enzyme intake will indicate compliance with medication, but not whether the child is getting sufficient calories. Question 71. A client with cystic fibrosis exhibits activity intolerance related to the pulmonary problems associated with his disease. However, he needs to be encouraged to participate in daily physical exercise. The ultimate aim of exercise is to, here are the options. Option A. Create a sense of well-being and self-worth. Option B. Help him overcome respiratory infections. Option C. Establish an effective, habitual breathing pattern. Option D. Promote normal growth and development. The correct answer is option C. Establish an effective, habitual breathing pattern. A regular exercise does promote a sense of well-being and self-worth, but this is not the ultimate goal of exercise for this client. B. Regular chest physiotherapy, not exercise per se, helps to prevent respiratory infections. C. Physical exercise is an important adjunct to chest physiotherapy. It stimulates mucus secretion, promotes a feeling of well-being, and helps to establish a habitual breathing pattern. D. Along with adequate nutrition and minimization of pulmonary complications, exercise does help promote normal growth and development. However, exercise is promoted primarily to help establish a habitual breathing pattern. Question 72. As a nurse works with an adolescent with cystic fibrosis, the nurse begins to notice that he appears depressed and talks about suicide and feelings of worthlessness. This is an important factor to consider in planning for his care because here are the options. Option A. It may be a bid for attention and an indication that more diversionary activity should be planned for him. Option B. No threat of suicide should be ignored or challenged in any way. Option C. He needs to be observed carefully for signs that his depression has been relieved. Option D. He needs to be confronted with his feelings and forced to work through them. The correct answer is option B. No threat of suicide should be ignored or challenged in any way. Threats of suicide should always be taken seriously. B. This client has a life-threatening chronic illness. He may be concerned about dying, or he may actually be contemplating suicide. C. Sometimes clients who have made the decision to commit suicide appear to be less depressed. D. Forcing him to look at his feelings may cause him to build a defense against the depression with behavioral or psychosomatic disturbances. Question 73. A 9-month-old infant is being examined in the general pediatric clinic for a routine well-child checkup. His immunizations are up to date, and his mother reports that he has had no significant illnesses or injuries. Which of the following signs would lead the nurse to believe that he has had a cerebral injury? Here are the options. Option A. Hyperextension of the neck with evidence of pain on flexion. Option B. Holding the head to one side and pointing the chin toward the other side. Option C. Holding the head erect and in the midline when in a vertical position. Option D. Significant head lag when raised to a sitting position. The correct answer is option D. Significant head lag when raised to a sitting position. This position is indicative of a possible meningeal irritation or infection such as meningitis. B. This position is seen most frequently in infants who have had an injury to the sternocleidomastoid muscle. C. Most infants aged 4 months and older are able to maintain this position. D. Infants older than 6 months of age should not have significant head lag. This is a sign of cerebral injury and should be referred for further evaluation. Question 74. During an examination, the nurse notes that an infant has diaper rash on the convex surfaces of his buttocks, inner thighs, and scrotum. Which of the following nursing interventions will be most effective in resolving the condition? Here are the options. Option A. Coating the inflamed areas with zinc oxide. Option B. Using talcum powder on the inflamed areas to promote drying. Option C. Removing the diaper entirely for extended periods of time. Option D. Cleaning the inflamed area thoroughly with disposable wet wipes at each diaper change. The correct answer is option C. Removing the diaper entirely for extended periods of time. A zinc oxide is not usually applied to inflamed areas because it contributes to sweat retention. B. Talcum powder is of questionable benefit and poses a hazard of accidental inhalation. C. Removing the diaper and exposing the area to air and light facilitate drying and healing. D. Infants may be sensitive to one or more agents in the wet wipes. It is better to simply clean with a wet cloth. Question 75. A 10-month-old infant's mother says that he takes fresh whole milk eagerly, but that when she offered him baby foods at 6 months of age, he pushed them out of his mouth. Because he has gained weight appropriately, she has quit trying to get him to eat other foods. The nurse's response is based on the knowledge that, here are the options. Option A. Milk intake should be limited to no more than 4 ATA's bottles per day and should be followed by iron-enriched cereal or other solid foods or juices. Option B. Milk is an excellent food and will meet his nutritional needs adequately until he is ready to eat solid foods. Option C. It is acceptable to continue to give him whole milk and to delay giving solid foods as long as he takes a vitamin supplement daily. Option D. He should be started on iron-enriched cereal, meat, vegetables, fruits, and juices prior to bottle feeds. Milk intake should be limited to 1 QT/day. The correct answer is option D. He should be started on iron-enriched cereal, meat, vegetables, fruits, and juices prior to bottle feeds. Milk intake should be limited to 1 QT/day. If the infant is given the bottle first, he will be less likely to be hungry enough to eat the solid foods. B. Milk is deficient in iron, vitamin C, zinc, and fluoride. It does not provide an adequate diet. C. The vitamin supplement will help, but the infant needs an iron supplement. D. Giving the solid food when the infant is hungriest will increase the likelihood that he will eat. The more solid food he takes, the less milk he will desire. Question 76. A 9-month-old infant was diagnosed with non-organic failure to thrive. During her hospitalization, primary nurses were assigned to initiate all infant feedings. The infant's parents question why they cannot feed their own child. Which of the following responses would be most appropriate by the nurse? Here are the options. Option A. By assigning the same nurses to the child, the nurses can begin to learn the infant's cues and feeding behaviors. Option B. The same nurses will prevent parental fatigue and frustration. Option C. The same nurses will prevent infant fatigue and frustration. Option D. Primary nurses will ensure privacy. The correct answer is option A. By assigning the same nurses to the child, the nurses can begin to learn the infant's cues and feeding behaviors. A consistent primary care nurses can better interpret infant cues and note feeding behaviors. B. A non-organic failure to thrive. The parent-infant dyad has already experienced difficulties in the relationship. These parents may already feel dissatisfied and frustrated. The primary nurse would be unable to prevent this. C. Assigning a primary nurse does not ensure that infant fatigue and frustration will not occur or can be prevented. D. Providing privacy does not ensure a change in feeding behavior. Question 77. The parents of a 2-year-old child are ready to begin toilet training activities with him. His parents feel he is ready to train because he is now 2 years old. What would the nurse identify as readiness in this child? Here are the options. Option A. Patience by the child when wearing soiled diapers. Option B. Communicating the urge to defecate or urinate. Option C. The child awakening wet from his naps. Option D. The age at which the child's siblings were trained. The correct answer is option B. Communicating the urge to defecate or urinate. Children experience impatience with soiled diapers when readiness for training is apparent. They often desire to be changed immediately. B. A child must be able to use verbal or nonverbal skills to communicate needs. C. A readiness indicator would be awaking dry from naps. D. The age at which a sibling was toilet trained has no implications for training this child. Question 78. A 5-year-old child is hospitalized for an acute illness. The nurse encourages the family to bring her favorite objects from home. What is the nurse's rationale? Here are the options. Option A. To reduce fear of the unknown. Option B. To keep the child calm. Option C. To establish a trusting relationship. Option D. To prevent or minimize separation anxiety. The correct answer is option D. To prevent or minimize separation anxiety. Objects from home do not reduce fear of the unknown. Children need explanations, reassurance, and preparation for the unknown. Also, parental presence can promote comfort and feelings of security. Be a calm, relaxed, and reassuring manner will assist in calming the child. The child's objects from home will not assist in calming the child. C. A trusting relationship is based on the quality of the nurse-client relationship. Objects from home have no impact. D. Favorite objects from home assist in creating a familiar setting. Also, these objects may prevent or minimize separation from the child's usual routine and family support. Question 79. A 3-year-old child was hospitalized for acute laryngotracheal bronchitis. During her hospitalization, the child was placed under an oxygen mist tent. The nurse's frequent monitoring of the child's temperature frightened her parents. Which response by the nurse would be most appropriate? Here are the options. Option A. Monitoring the temperature prevents undue chilling. Option B. Rapid temperature elevations can occur in children. Option C. Checking the temperature will prevent febrile seizures. Option D. Taking the child's temperature can prevent airway obstruction. The correct answer is option A. Monitoring the temperature prevents undue chilling. The refrigerated cool mist tent creates a cool, moist environment. The child as well as bedding and clothing may become dampened. Monitoring the temperature of the child will ensure warmth and prevent chilling. B. Only a low-grade fever is expected in laryngotracheal bronchitis. C. Febrile seizures are not expected with the low-grade fever. D. Inflammation of the mucosal lining in the respiratory tract can cause airway obstruction. However, monitoring the child's temperature would not prevent airway obstruction. Question 80. A school-aged child with asthma is ready for discharge from the hospital. His physician has written an order to continue the theophylline given in the hospital as an oral home medication. Immediately prior to discharge, he complains of nausea and becomes irritable. His vital signs were normal except for tachycardia. What first nursing actions would be essential in this situation? Here are the options. Option A. Hold the child's discharge for 1 hour. Option B. Notify the physician immediately. Option C. Discharge the child as the physician ordered. Option D. Administer an antiemetic as necessary. The correct answer is option B. Notify the physician immediately. Holding the child's discharge alone does not address the client's problem. Nausea, tachycardia, and irritability are all symptoms of theophylline toxicity. The physician should be notified immediately so that a serum theophylline level can be ordered. Theophylline dose should be withheld until the physician is notified. C. The child must be evaluated for theophylline toxicity before any discharge. D. Cause of the nausea should be investigated before the administration of an antiemetic. Question 81. A neonate was admitted to the hospital with projectile vomiting. According to the parents, the baby had experienced vomiting episodes after feeding for the last 2 days. A medical diagnosis of hypertrophic pyloric stenosis was made. On assessment, the infant had poor skin turgor, sunken eyeballs, dry skin, and weight loss. Identify the number 1 priority nursing diagnosis. Here are the options. Option A. Fluid volume deficit. Option B. Altered nutrition. Option C. Altered bowel elimination. Option D. Anxiety. The correct answer is option A. Fluid volume deficit. A fluid volume deficit is the major problem. Symptoms of dehydration are evident. The effects of fluid and electrolyte balance may be life-threatening. Rehydration can be accomplished effectively through Roman IV fluids and electrolytes. B. Vomiting may also signal a nutritional problem. However, the nutritional problem would be secondary to fluid and electrolyte disturbances. The infant may also be placed on NPO status. C. With vomiting, a decrease in the size and number of stools is expected. D. The infant cannot verbalize feelings of anxiety. Anxiety would not be an appropriate diagnosis. Question 82. A baby who was diagnosed with pyloric stenosis has continued to have projectile vomiting. With prolonged vomiting, the infant is prone to. Here are the options. Option A. Respiratory acidosis. Option B. Respiratory alkalosis. Option C. Metabolic acidosis. Option D. Metabolic alkalosis. The correct answer is option D. Metabolic alkalosis. A respiratory acidosis is the result of problematic ventilation. Plasma pH decreases, while plasma PCO2 and plasma HCO3 increase. B. Respiratory alkalosis results from increased respiratory rate and depth. Plasma pH increases, while plasma PCO2 and plasma HCO3 decrease. C. Metabolic acidosis occurs when there is strong acid gain in the body. Plasma pH, PCO2, and HCO3 decrease. D. Increased risk for metabolic alkalosis is due to a loss of hydrogen ions, depletion of potassium, sodium, and chloride when vomiting occurs. Plasma pH and plasma PCO2 increase. Plasma HCO3 may decrease and then increase to compensate. Question 83. Parents of young children often need anticipatory guidance from the nurse. Parents may have little knowledge regarding growth and development. Which of the following toys and activities would the nurse suggest as appropriate for a toddler? Here are the options. Option A. Cutting, pasting, string beads, music, dolls. Option B. Mobiles, rattle, squeeze toys. Option C. Pull toys, large ball, dolls, sand and water play, music. Option D. Simple card games, puzzles, bicycle, television. The correct answer is option C. Pull toys, large ball, dolls, sand and water play, music. These activities are suited for the preschool-age child 35 years old. The activities are not safe for a toddler. B. Infants 0-1 year like these toys. C. These activities provide the toddler 13 years old with a variety of physical activities for play. D. The toddler lacks the physical and cognitive abilities for these activities. The tasks are far better suited for the school-age child. Question 84. A 5-year-old child cries continually in her bed. Her parents have been unsuccessful in assisting her in expressing her feelings. Which activity should the nurse provide the child to assist her in expressing her feelings? Here are the options. Option A. Books with colorful pictures. Option B. Music. Option C. Riding toys. Option D. Puppets. The correct answer is option D. Puppets. Books increase cognition, assist with fine motor skills, and augment language development. B. Music provides auditory stimulation and large muscle activity. C. Riding toys provide large muscle activity. D. Puppets allow expression of feelings and fears that otherwise could not be directly communicated. Question 85. During his hospitalization, a 3-year-old child has become unusually aggressive in his play activities. His parents report this change in behavior to the primary nurse. How could the nurse explain the child's change in behavior? Here are the options. Option A. Deep-seated feelings of hostility. Option B. A lack of interest in socializing. Option C. Usual behavior for this child. Option D. A coping response. The correct answer is option D. A coping response. Unusually aggressive behavior does not indicate a deep-seated problem. B. A lack of social interest results in poor participation in play activities with peers. Aggression would not be an expected behavior. C. The aggressive behavior was newly developed and not a routine behavior. D. Play provides the child with opportunities for coping and adaptation. Aggression during the play activities would indicate a coping response. Question 86. Following her surgery, a 5-year-old child will return to the pediatric unit with a long-arm cast. She experienced a supracondylar fracture of the humerus near the elbow. Which nursing action is most essential during the first 24 hours after surgery and cast application? Here are the options. Option A. Mobilization of the child. Option B. Discharge teaching. Option C. Pain management. Option D. Assessment of neurovascular status. The correct answer is option D. Assessment of neurovascular status. A mobilization is important but not absolutely essential. B. Discharge teaching should be initiated prior to surgery as well as during the postoperative period. C. Assessment and management of pain are necessary and high in priority. D. Neurovascular status of the extremity is of primary importance. The risk of circulatory impairment exists with any cast application. This type of fracture is common in children. A high incidence of neurovascular complications exists with fractures near the elbow.